Hi, everybody. Welcome to our webinar, Improving the Employee Experience of Healthcare Workers, Winning the War on Talent. My name is Ken Rooney. I'm going to be a facilitator today. Just wanted to let you know just a couple of logistical things. We are recording this program. If you do have questions, please submit your questions or comments via the chat feature, and we'll consolidate them during the time. We are offering 1 CPE credit for this live session. To get that, you need to be here for the full webinar, as well as there are going to be 3 polling questions at various intervals during this. So be sure you answer those questions. And then we send out the CPE certificate to you within 2 weeks, once we see that you've answered those questions. And then you'll also be getting a survey after this webcast for any receiving any additional information, getting feedback, or even other webinars that you would like to hear from us. Okay. So with that said, I just want to turn over this to Mark and to Bruce from our Veracity practice, who are going to introduce themselves and then start with our program. So Mark.
Great. Thank you very much, Kenan. And thank you all very much for attending and joining us today. As Kenan said, my name is Mark Deutsch. I'm the Managing Director of Business Development for Veracity. And I've been in the business world for a good 28, 29 years, I'd say. And the majority of that experience has been in the healthcare arena. In fact, immediately to joining Veracity a couple of years ago, I was the CEO of the largest pediatric medical group in the state of Virginia and one of the larger organizations in the country. And prior to that, had my hands in diagnostic imaging centers, IV infusion therapy, home medical equipment organizations, revenue cycle management, as well as telemedicine clinics. So it's my pleasure to be here with you today to talk about the topic around employee experience. A lot of work that we do at Veracity, which is an RGP company, is around human-centered design. And so everything that we do, we focus on building around people. Sometimes the solutions may involve technology, sometimes not, but at a core conversation point around today's topic, to keep in mind, the work that we typically do focuses on the person, and that's key when it comes to the employee experience that we'll talk about today as well. So with that, Kenan, next slide, and Bruce, if you'd like to introduce yourself, sir.
Sure. Thanks, everybody, and thanks, Mark. I think I learned something new about Mark today, so that's great.
And Bruce, are you wearing the same shirt that's in this picture?
No, actually, that's a different shirt. That's my
same color. Looks good on you.
Yeah, people refer to that as my prison shirt. So I've never been in prison. But on a serious note, glad to be here. I am a healthcare advisory consultant with Veracity Consulting, and I've got over 30 years experience, and I guess approximately 12 of those years specific to healthcare, and many of which have been in the health insurance payer space, as well as working at the state level at Department of Health agencies and the CDC and CMS and so forth. So just a wide variety of experience. And I'm currently engaged with a healthcare client as we speak, and just got off a meeting to join this one. And so the topic is very fresh. There's lots of buzz going on around this right now within the industry, and we're feeling it even in the health insurance payer space. So anyway, looking forward to the conversation.
Sounds good. Kenan, next slide, please. There we go. Perfect. Good timing. Good timing. So our key takeaways today, is hopefully you saw when you had a chance to sign up for joining us for the webinar today, is how to define a meaningful work journey and career paths. And this concept around employee journey, I'll just highlight because it's something we do a lot of work in, and it is really getting a lot of attention nowadays for the reasons we'll talk about today. And how to create opportunities for collaboration with your teams is a critical challenge and opportunity. How to simplify technology and processes is a growing area of opportunity. And also, we're going to encourage you to create what we call a radically empathetic work culture that we'll talk about here in just a few more minutes. So those are some of the key takeaways that we'll drill down into here during the course of our conversation today. So next slide, please. And we'll start out by talking about a term that hopefully you all are familiar with. It's gotten a lot of airtime over the past few years, which the current trend in the marketplace is considered the Great Resignation. For better or for worse, currently in the current environment, it is challenging to find talent, challenging to keep talent and keep them happy. And a lot of people, more than ever, in fact, in history of the workforce, are resigning. I think it's been as high as 5 to 6% of folks are resigning from their jobs. And that trend shows no signs of changing. It's been gradually going up, seems to have kind of flattened out around between 4 and 6% of folks are continuing to resign every month from their jobs, but we don't see that changing. The Great Resignation is something that has been called. It's also been termed other things, such as the Great Discontentment is another term that I've heard. The Great Realignment is a term that I saw this morning, in fact, in a news article. So whatever you call it, the bottom line is that it is challenging to get and to keep employees. And it's especially been exacerbated over the past really 20 months since COVID struck. We're coming up on a 1-year anniversary soon of when COVID really started. I've seen more change in the past year and a half, 2 years than I saw in the prior 6 to 10 years when it comes to employees. We always seem to go through these cycles, but it certainly seems to have been a more powerful trend than I've seen any time in my working history of, again, close to 30 years. So we're all really been put to the test when it comes to our plans of how to tackle this and how to respond to it and how to really leverage this as an opportunity. I'll also note you see a name down here, Anthony Klotz. He's a business professor at Texas A&M, and he is credited with coming up with the term, the Great Resignation. So next slide, please, Ken. All right, Bruce, I think this is yours.
Sure thing. Yeah, so I think, and as I've told Mark, I'm in the car a lot, and I'm usually listening to NPR, and it seems like every time I turn on the radio and listen to NPR, there's another story about this topic. So there's so much going on right now in this arena, and it's worth having this discussion. I think within the healthcare space itself, market analysts are saying that the healthcare industry's turnover rate is the second worst only to hospitality. And, it's one thing if you go to a restaurant and it takes them a long time to get your meal out, but it's another if you go to a hospital and you can't get the service that you think you deserve in a timely manner or in a safe environment. So all those things are going on right now, and healthcare just seems to be hit the worst or second worst, according to analysts. So I think they're saying, I've read this survey from the AMA, between the end of May and beginning of October in 2020, the AMA surveyed 42 healthcare organizations across the US, almost 21,000 physicians and other healthcare workers. And they found that 61%, it's a huge amount, of those surveys felt that they had a high fear of exposing themselves or their families to COVID-19. While 38% of those self-reported experiencing anxiety or depression as a result. Again, huge numbers. Another 43% suffered from work overload, and 49% said that they had experienced COVID-related work burnout. So again, just mind-boggling numbers and how this has impacted people's lives. And I think for me personally, it's been the largest impact in my life in all of my years. And it's probably not going to go away from what we're hearing. Omicron is here, and it'll go away, and then a new variant will come along. So we're learning to live with it. And that's part of this conversation today is how do we live with this from an employee retention standpoint? We've all heard the reports that between 20 and 30% of all healthcare workers say that they are considering quitting their current jobs and/or leaving the profession. Again, just mind-boggling stuff when you think about the amount of effort and money that goes into pursuing an education and then certification and degree in healthcare, whether you're a RN or practical nurse, a physician or specialist. For someone to say, gosh, I think I'm going to leave this profession because this is just too stressful is just crazy, but it's real. Most of it's natural. Experiencing an event like this, a life-changing event, makes us all ask, about, life and how we fit into it and all those bigger questions. we don't always experience these kinds of macro events at the same time that we have COVID. But what's driving this change? There's no doubt that people are seeking that kind of change, looking for other careers, other ways to make a living. And the question stands is, what do we do about it? And that's really the conversation that we're here to have today. So, Mark, I'll turn it back over to you.
Great. And as we do that, as you said, Bruce, it's been interesting that you can go to the next slide, please, Kenan. But as you mentioned, I'm sorry, time for a polling question first. Before I jump in, I'll wait.
So I'd ask those questions.
So really quickly, everyone, has your organization been affected by the Great Resignation? It's pretty resounding. 83% of you said yes. So that's quite resounding.
And where was your Vanna White music?
Yeah,
right.
This yes or no question, I can pull up some music when you need it. So, yeah, so 83%.
Wow, that's a big number.
Yeah, it's definitely, it's hard to, and again, it's affected positively or negatively. I think, that there have also been some positive ramifications depending upon the industry you're in. For example, our organization, RGP, we focus on really providing a lot of gig workers in environments. So that's been very positive in that respect. A lot of people have taken this time to look at their careers and opportunities and have chosen a different path. As an employer, I think it does pose a great challenge. As I mentioned earlier, one of my previous opportunities was in owning diagnostic imaging centers. And there was a time in that environment where RT, radiology techs to do MRIs could demand whatever they wanted because there was such a severe shortage. So again, these trends tend to come and go, but this one seems to be one that's going to be here for some time. As Bruce mentioned, I can't turn on the radio and listen to NPR as well, or the TV or newspaper or e-newsletters or podcasts and get away from this story. In fact, earlier this morning, there was a story, I think it was on NPR, as a matter of fact, that was talking about how a lot of individual employees these days, again, are taking a look at what they want to do and are opting to move around. They're nomadic. So they're moving to foreign countries that have good internet access because they can work from anywhere that they want to. In the healthcare space, another story in NPR this morning, I believe, was about how Wisconsin, I believe, is the latest hotspot for COVID, and they're bringing in the National Guard and going to be training National Guards people how to be CRNAs so they can serve the healthcare community in Wisconsin because there's such a shortage of healthcare workers in that environment. So the headlines seem to be never ending. Here are just a few interesting ones that we pulled out. Nursing turnover is 15.8% in the past 12 months, a 4.7 increase over the same time last year. That was in the fall of 21. And a few weeks into the pandemic, medical group MGMA found that COVID-19 had a negative financial effect on 97% of 724 practices surveyed. Thousands of medical practices have closed during the pandemic. I think we've all likely seen that impact. Healthcare workers, the pandemic is getting away of providing great care. So you can see the list goes on in terms of many of the headlines that we're seeing in the marketplace that continue to reaffirm that it is just a really challenging environment. And when it comes to healthcare workers, we not only have a shortage of all kinds of healthcare practitioners that Bruce mentioned that was already going on. Now it's really just been exacerbated due to COVID-19. And again, there's no end in sight for when we'll see resolution of this situation. So next slide, please. And so the pandemic really, has changed the way that people work, right? So a lot of people have taken a step back and are prioritizing their passion and their purpose as individuals. This we already knew was a priority for millennials as well as Gen X, which is coming right behind, or Gen Z, I'm sorry, coming behind the millennials. So the passion and purpose of your organization is really important to those populations, more so than ever. Having a culture of flexibility really is key as well. And we'll talk more about exactly what that means. Reducing monotonous tasks. And the story I saw in one of my news feeds today was about the growth of and resurgence of RPA, robotic process automation. So a lot of organizations, because of the fact that unemployment is so low, they have a hard time finding people Used to be a fear of robots taking over people's jobs. Now many organizations are aggressively using robots and robotic processes to do jobs because they just can't find the employees to do the work. And frankly, more employees don't want to do busy work when they know that a robot or a computer can do this task. I'd rather have a computer do that so I can focus on what's really interesting and really challenging work. And we're seeing a lot in the healthcare space as well these days. So reducing monotonous tasks is important, and also reimagining what normal business hours are. A lot of organizations are taking a hard look at how can I be really flexible in the environment, as I mentioned earlier, but really looking at their hours that people are working and how can they better manage that time for their staff. So within healthcare, this is a challenge as well. We have the historic for nurses, for example, 12 on, 12 off for a lot of folks. That may be changing. You might have to shorten some of those shifts if you can find more people. You might need to lengthen some of those shifts because you can't find people. But we have to take a hard look at when and where we operate. For some of the back office staff, we've seen that change as well. People that are processing claims or providing other types of work for healthcare systems are having to be more flexible in terms of the hours that they work. An interesting study that was conducted by the Jackson Physician Search Organization last year. That's a national physician recruitment organization. Got responses from 400 physicians across a range of specialties from 86 healthcare administrators throughout the United States. And their study revealed that nearly 70% said that they're actively disengaged from their employees and employers. 70% actively disengaged. It means only 30% are happy. So it's critical when it comes to an employee experience. How do we respond to that 70% of folks that consistently you see this type of statistic across different industries and many organizations that are just not happy, but it's especially tough in the healthcare environment where there's so much pressure currently. In the same survey, 54% of physicians surveyed said COVID-19 had changed their employment plans. So a lot of folks, over 50%, are considering retiring, leaving, or finding a new employer where they can have their stress reduced rather than the current practice. So again, this is the current environment really has made a lot of folks take a hard look at their work and their purpose and their passion and looking at doing something else. According to the Kaiser Family Foundation, another interesting study, as COVID cases began to peak in the spring of 2020, health centers around the country reported that around 1 in 10 or about 11% of their staff were not able to work due to family, well-being, or other reasons. We've also seen this in healthcare with vaccine mandates and other types of mandates for healthcare workers that some people are just not able to work because they can't fulfill those requirements. So continue to see that as being a challenge. Just your number of staff available are reduced by virtue of they're unable to work. A lot of states have very aggressive practices when it comes to when you've been exposed to COVID, for example, to make sure that you quarantine properly. So that's impacted. Many states have changed to 5 days based upon the CDC recommendations to come back to work with a negative test, perhaps, but that certainly is a challenge, and it varies state to state, in some cases, city by city, county to county. Another interesting statistic, or from the Gallup, a Gallup poll, suggests the pandemic has changed the way we work and how they view work, requiring those who want to retain talent to engage more and give their workforce a sense of purpose. Purpose, as I've mentioned several times, has become really one of the top things that people are interested in within their organization. So, just how do you deal with that? How do you manage through some of these challenges? And as I mentioned earlier, we want to encourage you to focus on a concept of radical empathy. And what radical empathy really means is digging in. It means truly understanding what your employees are thinking, what they're feeling, what they're hearing, what they're seeing, what they're doing, rather than paying lip service to that and really caring about the folks, truly digging in and caring about your people and showing that you care, because that is what employees want to see at a minimum within an organization, as that you care about them. Yes.
Hey, Mark, you used the word actively disengaged. I'm curious if you have actively disengaged, does that also show that there's a decrease in productivity, and then therefore somebody else is another group may be implicated that they're overly then they're overworked, right? Can you kind of connect that? What's actively disengaged? Because in healthcare, I can't imagine you just can't do it's not like you can't just do your job.
Right. Yeah, I think in this context, what the research and many of the studies have shown that it really alludes to a lack of caring, a lack of compassion in some cases. So active disengagement in terms of just doing the bare minimum to fulfill the requirements of my job. But I might not want to go, bend over backwards and beyond the call in order to take care of a client or take care of a patient. So we're seeing a lot of folks that are just disengaged in terms of, I'm just going to provide the bare minimum service that I need to provide to somebody because I'm just so burnt out and I'm getting attacked on all sides in some cases. So disengage in that respect. So not negligent in any way and negative, I'd say, but just disengage in terms of not really providing more than 100%, in many cases, just providing the bare minimum to get by as an employee is what we're seeing quite a bit of. And it does have an impact on other folks, for sure.
Yeah. I was going to concur. I think so much of it is stress related and just worrying about their own health, their family's health, trying to manage and juggle their basic life functions around all of this and trying to do their job, and something has to give, and it's not their choice, but it's a reality. So it's
That's
tough,
right.
very tough.
It is. And so, with that in mind, some other things that you can do or consider doing to help mitigate this challenge within your organization is a lot of organizations are creating peer-to-peer support groups. So again, acknowledging that stress is at all-time highs for healthcare workers of all different shapes and sizes. As you mentioned, Ken, and I think it's, if people are not giving 100%, then that percent's got to be spread to other workers. So it continues to cascade downhill. I think if you've got a group of people that are less engaged, then the other folks in that department or that are impacted are going to be affected by that. So, for example, one thing I've seen is people not being as diligent when it comes to billing and entering billing codes. So my wife is a research pharmacist, and even in her organization, they went through a massive system change at their hospital this past year. And as a result of that, a lot of people were just frustrated. So they were just entering things into the new system at a very basic level. And so billing codes weren't entered properly, and that would cascade downhill. So now your billing people are frustrated because the clinical folks are not entering the information they need to do their job. And that affects other people in the collections department who are now frustrated that the billing didn't do their job. So those types of challenges can cascade if we're not very careful. So a lot of folks are responding with some of these ideas. Again, peer-to-peer support groups, getting folks together to talk about these challenges and providing a platform to do that, making sure that you communicate, especially as a senior leader. You're communicating with your folks frequently, transparently, and efficiently, and keeping active employees informed, engaged, as well as those who are furloughed or are quarantined due to COVID, for example. Make sure they're all aware and communicate with them exactly what's going on to keep them engaged as much as you can. Consider, if you're not already, offering tools such as on-site health childcare. So childcare has been a challenge for a lot of folks, with childcare centers and facilities closing or less accessible due to the COVID situation. Can you provide that now on site for folks, especially if it comes to sick care for kids? So a lot of your really large organizations might provide this, but maybe the medium-sized and smaller organizations might want to consider similar things. So that might be helpful. Or if you have people that have children, pairing them with other people to ensure that their shifts are covered. So you might rotate those people through one another. So when one needs childcare, they've got someone else representing them in that department. So you just might want to look at shift coverage a little differently. Give people extra time to manage their personal issues, additional PTO if you need to in order to manage personal challenges. And you might want to suspend certain educational internal competency requirements unless they're absolutely required. But you might want to take away some of the optional opportunities at this point, just because people just don't have the time to take advantage of them, and shift those resources to other areas. Enable employees to work from home whenever possible. So it's been amazing how many organizations 3 years ago would say, no way that these jobs can be done from home, and within 24 hours shifted to those jobs being able to be done from home. So of course, we're all sensitive to HIPAA and privacy issues when it comes to healthcare. It is more sensitive, but a lot of firms have shifted employees when and where at all possible, getting creative to see if there are ways that people can work from other environments, such as your home. So that's something to consider. Make sure that you offer EAP services, so employee assistance programs. Make sure you give your employees, they're fully aware of what those benefits are, how to take advantage of those benefits, and that they are, if they're feeling stressed, as Bruce and I both have mentioned, stress is a tremendous issue right now. So provide that environment and solutions for your folks. Some other areas to think about that Bruce is going to talk about shortly is in the Journal of the American Medical Association. JAM, as we may know it, has identified some specific areas where healthcare professionals expect and need support. And Bruce is going to be drilling into these here in a few minutes. Just at a high level, they're hear me, protect me, prepare me, support me, and care for me. So those are some specific areas that JAMA has identified that there are some opportunities to help healthcare folks when it comes to their employee experience, those overall themes. And we're going to spend a few minutes talking about those here shortly. Before we do that, Ken, I think we have our second polling question.
Great, thanks everybody. Let me pull up the polling question. If your organization has been affected by the Great Resignation, then which of the following do you believe has contributed most? Stress and burnout, shortage of facilities/supplies, personal safety concerns, feelings they cannot provide the level of care needed, or lack of management support? I'm going to read that question. So which one of these do you believe has contributed the most in your organization to the Great Resignation? And give a couple more people a chance to answer. Yeah, I'm just going to cut it off here because it's all falling into one place pretty much, everyone. It's the stress and burnout. Is all laid right there.
Yeah, as we mentioned several times, right, that's a consistent theme, the stress and burnout. And so hopefully some of the suggestions I made earlier, and again, starting with this perspective of radical empathy, not to just blow it off and say, we're all going through stressful times now, we just have to learn to deal with it, to really take the time necessary to understand your employees, understand their feelings, take the time to listen to them, take the time to react to their feelings and the challenges. That's a critical way organizations that are doing that are being successful in recruiting and retaining talent, especially in the current environment. So with that, I think, Bruce, you've got the next section here.
Yep. Thanks, Mark. Yeah, I was just listening to, I think, the strategies that you were just discussing, and we're going to touch on those in a little bit more detail in a moment. But it got me thinking about back in the 90s, I was working for in the corporate offices of a large big box retailer. And I was working with the HR group there on some analytics. And what we came up with at the time, again, this was the 90s, the cost of replacing somebody who quit the company, quit their job, and having to rehire somebody into that role was somewhere around $50,000. And so when you think about, some of these programs and you go, gosh, we can't afford to do that. That's just too much money. Well, if you really run the numbers and you think about it practically, I mean, you can't afford not to. The cost of replacing RNs and physicians is incredible. So it may seem daunting at first as we talk about these things, but do keep that in perspective and think about the cost of not doing them and what it would cost your organization to have to replace people. And these numbers that we're talking about, it's a huge number. So anyway, I guess the real question here of all this is, how do you retain workers in such a stressful time as COVID-19? Again, it seems like every time we get a foothold and we're doing better with regards to the number of people getting sick and hospitalizations and deaths, a new variant comes along, and here we go again. So the answer really is, I think, as Mark has been talking about all along, is designing an employee experience that supports their concerns, both professionally and personally, as well as their talent and their growth within the organization. So let's revisit the 5 requests that came out of this JAMA survey that we mentioned a moment ago. They were: hear me, protect me, prepare me, support me, and care for me. Let's talk about those one by one in a little bit more detail. So number 1, hear me. This is really the crux of everything to me, not just in this situation that we're in, but in life, right? In anything you do, listening to people and then acting on what they're telling you is of primary importance. We have two teenagers. We've got twin 18-year-olds in their first year in college. And Lord, if I didn't learn that lesson a long time ago, I would have failed as a parent. But you got to be able to listen. You've got to be able to really empathize with what people are saying, and not just listen for the sake of listening, but listening to act, right? To formulate an action plan. What are we going to do about this? And we'll talk more about that in a moment, about really engaging them in the solution as well. But it starts with listening. So never stop communicating. With the COVID-19 pandemic in constant flux, leadership is really needs to communicate with each other and their employees throughout the day. It should not be a once a week or once a month thing. In these times, it needs to happen continuously, not just active folks, as Mark has said, but also folks who may be furloughed, working from home. Don't leave them out of the loop. What happens when people are left out of the communication chain is, rumors start, right? And then, tendencies towards people disengaging. They start looking for other opportunities because they feel like they're not being heard, they don't know what's going on. So communication is key. And then empathy. Can't stress it enough. Listen and understand what your folks are going through day in and day out. They will tell you. If you ask them, they will tell you. But then offer strategies to help. But don't just offer strategies, ask for strategies. Get their buy-in, get them to come up with, co-develop a solution or solutions. But it all begins, like I said, with providing opportunities for them to talk and for you to listen and then to act. So that's number one. Protect me. Okay, this is really reducing my risk of acquiring and transmitting COVID-19. Seems obvious, right? We've been in this for almost 2 years, and we should know everything we think we know about how to do that, how to protect yourself. But the opportunity, I think, is there for you to re-educate and constantly educate your staff on recognizing the signs and symptoms of infections, staying home when people are sick, social distancing, PPE, hand hygiene practices, all that stuff. Because I'll tell you what happens, and it happens to me, we slip, right? I find myself occasionally, I'll get out of the car and run into a store and go, darn it, I forgot my mask. And I'll go back in and get my mask and put it on and then go back to the store. And it's not because I don't know that, it's just because I forget. And it's almost become second nature because we've been in this for almost 2 years. But I think reminding people what the protocols are, that we're not out of the woods yet, and that this is something that's probably gonna have to live with for a while. But unless we adhere to these things, that it's not gonna go away. And then, of course, providing all the safety strategies, PPE, et cetera, that are needed to keep your staff safe, making sure that they have the tools that they need to protect themselves and their families. Because, if not only if they get COVID or if one of their family members get it, again, nobody wins. There's no positive situation in any of that. It makes staffing more difficult. It makes patient care more difficult. It's just it's a never-ending saga. So again, to the point where you can protect your folks, that's key, very key. That's what folks are asking for. The next thing up is really to prepare me. So, and this goes into, I think, the training that Mark was talking about and support that folks are asking for. We've been doing this for some time, even before COVID, but really transitioned the healthcare space. But now where teams typically include physicians are.
Hey, Bruce.
Sorry? Yeah.
Can you turn off your video, because you're coming in and out, and see if that helps in your bandwidth, and then we can come back. We all know what you look like now. There we
All
go.
right.
Let's see if that helps. Thank you.
Is that any better?
Yeah, just keep talking. We'll know. So go ahead.
Okay. Well, part of the problem is I'm in northeastern North Carolina in a small town. So we have what my friend calls country Wi-Fi. So I apologize. So again, talking about this team approach and how we need to move to that model to really to weather the storm. It's like when we all, at least a lot of us, watch football on TV, and you hear it every single time you turn on a game. It's one guy gets hurt. It's the next man up. It's a team approach. The next guy up has got to come in and take that other guy's responsibility and help win the game. It's the same in healthcare. If we take that approach and we think about it as a team approach and always keep our members and our patients top of mind, then that's the approach we ought to take. But for some, it's a shift, right? So it's making that change from a me first to a we first mentality. Embracing telehealth. So when I think COVID first got going, I was running out of my blood pressure medication, and my primary care physician wasn't taking appointments at the time, so we did a telehealth session, and it was kind of weird at first, I have to admit. But and it was a procedure that didn't need him to be with me when we were going through the appointment. So it worked out great. He got what he needed from me in terms of the questions that he wanted to ask and my answers, and I got a pretty good feeling at the end that he listened to me, understood what I was talking about, and at the end I got my prescription refilled. So that was great. But for a lot of people, it's kind of a weird thing to really engage with, but it's going to become more commonplace than we think. So if your organization hasn't embraced it yet, do consider it. It's a valuable way to increase access, especially to specialists, with a wider network of care in rural areas, as well as providing a convenient choice for people in urban areas. So, but to do that, right, to provide this demand for this growing virtual care, physicians will need training on how to use and how to integrate these new digital tools and practices in their medical practices, as well as strategies for minimizing digital fatigue and so forth. So, it's communication skills. I think that's key, right? Because when you're in a one-on-one with a doctor, sometimes communication maybe isn't as key. I don't know. But when you're dealing with someone in a telemedicine or telehealth appointment, communication is absolutely top of the list. You've got to be able to communicate well, and determining the right criteria when recruiting for those kind of skills is going to be important as well. It's not everyone's cut out for it. So in addition, telehealth solutions provide an opportunity for hospitals to extend in-person staff. When you think about a single nurse with telehealth skills, he or she can remotely monitor multiple patients at one time and immediately summon help if a patient appears at risk. Whereas if nurse without telehealth capabilities, you're kind of stuck with a one-on-one situation. So telehealth solutions provide an on-demand access to specialists, but also supplement limited or overstretched physicians or RNs, particularly in smaller facilities. Another strategy here is really, and Mark alluded to robotics earlier, and we frame it here as artificial intelligence, but the accelerating artificial intelligence or AI adoption. And again, this can be kind of a weird thing for people in healthcare to think about, because we think about, robotics, robots taking over the world and all that. That's not what this is about. I think as Mark said, as we think about how do you use AI and robotics to manage the administrative and mundane tasks that folks are spending a large amount of time doing. I don't have the study in here to refer to, but I remember reading about it in preparation for this, that physicians were surveyed about how much time they spend each day on paperwork, and the number was astonishing. It was hours and hours a day. It was like the bulk of their day was spent in paperwork. I don't know if that can be, ported over to an AI solution, but we need to think about how we spend our time. And is AI adoption really an option for folks and organizations as we move forward in this new world of COVID? So again, as with telehealth, AI adoption requires reskilling, upskilling, redefining people's roles. But by educating and demystifying AI's potential for changing the way we work, we can cultivate an openness to a digital mindset that embraces AI. And again, it's a big shift. I understand it's going to be a big shift for a lot of folks, but it's going to be our future, like it or not. The next thing up is that Mark alluded to earlier was support me. And this, again, talks about how we acknowledge and support your folks' human limitations. So I think first and foremost, rewards and recognition matter to people. We've known this for decades now. When you reward people, when you recognize them for their good work, it makes them feel good. It makes them feel more engaged in their work, and they want to stay and do the work that they do. So, top priorities for your workforce, including acknowledging the intensity of the working conditions, celebrating their commitments, supporting employee well-being throughout the pandemic. Two examples, both from Missouri, oddly enough, but Truman Medical Centers, TMC in Missouri, supplemented its ongoing rewards and recognitions program that they called True Success. And they supplemented their bonuses to employees of the quarter in several different ways. They've begun supplying fresh produce baskets for a number of weeks. They funded full scholarships for more than 20 employees' children for the Y Learning Academy. They offered individual exercise sessions through their PT and rehab departments, and also provided low-cost dinner to-go meals every weekday. So they were thinking outside the box, thinking of programs that they could do to support their staff and help, again, recognize the fact that, hey, we know what you're going through. Here are some things that hopefully let you know that and hopefully make your life a little bit easier. Liberty Hospital, again in Missouri, expanded its reward and recognition efforts to include sending treat carts to units to help them de-stress. They brought in food trucks on site, they had a welcome parade with thank you signs, and they also increased their referral bonuses, and as well as loosening its dress code and so forth. So again, a couple different examples of ways that organizations are looking for how to really care for your folks or support your folks. Caring is the next thing that people were asking about, care for me. So again, providing holistic support for me and my family. And Mark talked about consider offering EAP or employee assistance program services if you don't already. And if you do, look at revamping what services you provide. These services are crucial to worker mental health when challenged to the point of burnout. It's one thing to talk to your family, who's also going through their own issues, perhaps with COVID. If you go to your manager, they may or may not care to the point where they're really going to be helpful to you. But if you go to a professional, which is what the EAP program provides, you're going to get some really focused listening and focused strategies on how to deal with burnout. So again, I can't stress enough those services. And I just worked with a client and on their international EAP program, and I was just amazed by the utilization of that program internationally. And I think sometimes people are, it's like I think veterans coming back from war who are, dealing with PTSD. There's a shame sometimes with reaching out, and a lot of folks don't. But offer the services, tell folks that the services are there, encourage them to use them. Yes, there's a cost, but again, if you consider the cost of not offering those services, you'll see that it's certainly worth it. pandemic-driven job losses, school closures, illnesses, they're meant to help, with expenses, including childcare, food, and rent. Those are things that we really need to think about. Some hospitals offered bonus COVID pay to help with their routine and unanticipated expenses as well. So those are some strategies right there. I think that Mark talked about that. We're talking in a little bit more detail. So I think now there's a polling question that we wanted to throw in, Keenan.
Great. Yes. Hi, everybody. The last polling question here. Polling question number 3 on the screen now. Which of the top 5 concerns does your organization struggle with the most? Hear me, protect me, prepare me, support me, care for me. Oh, this is very telling too. Okay. A couple more people responding. Yeah, right. Bruce and Mark, just so you know, it's 15 minutes till the top of the hour. Just wanted to share. Okay, I'm going to go ahead and shut this down. This is actually really interesting, this response. Everybody, share results. Look at the even spread across hear me, prepare me, and support me.
Interesting.
So I think everyone feels protected, right, with the mask and but there's something here around this that's spread across this group.
Interesting. Yeah, you could actually, in some sense, combine hear and support me.
Mhm.
I think are very similar. I think as well, but that is kind of interesting. So even between those two, that's greater than half the folks. And
yeah, fascinating.
Yeah, it really is interesting. And again, something we see pretty consistently. So in a lot of the employee experience and workplace experience work we do, the first element of that tends to be identifying and understanding and defining your employee's journey and the journey that they're on. And again, it goes beyond just making sure that I get onboarded properly and I get my name badge and I get my benefits set up. It's something much more significant than that in terms of understanding their journey. So that's interesting, but that tends to come up in those conversations as well, as that I want to be part of an organization that listens to me, that really shows that they care about me. And as Bruce said earlier in this, I love this quote, he mentioned the high cost of replacing somebody when they come on board, because and I've seen it range from, for example, a number you gave, Bruce, which was what, about $50,000, I think, with the retailer you worked with, to hundreds of thousands of dollars to replace somebody. Especially if you think about a physician or subspecialist, you get them onboarded, you get them started. The amount of energy and money spent on getting them involved, and then a year later they leave, or 6 months later they leave to go somewhere else, the cost is substantial. So if you have you show your employees that you've got a positive workplace experience, they show a greater sense of belonging, and that's associated with a 50% drop in turnover risk. So all the elements we just talked about earlier are critical when it comes to making sure you create a positive workplace experience. So as we close out the conversation today, to really compete and win the talent war, it's critical for organizations to practice this idea of radical empathy as a foundation. What that really means is, instead, for example, of making decisions and then asking your workers and employees what they think about the decision, engage them and involve them in the decision-making process, especially in today's environment. I know historically I'd seen it in healthcare, an example over and over again, where facilities or new locations were built and the nursing stations were located in something architecturally that makes sense, but from a workflow standpoint made no sense, or hospitals with floors that are designed that way, just not taking the employee's perspective into account. And as I mentioned earlier, my wife works in a very large teaching hospital, and she saw this recently. They opened up a new facility and they just designed it without taking the employees into account, and designed from, again, a building and a facility standpoint correctly, but from a workflow standpoint and a quality of work life for their employees, not necessarily the best methodology. So keep that in account, take that into account, be empathetic with your employees to the point of radically so. Remember from the earlier discussion that Bruce covered, what healthcare workers are really looking for from their leadership, especially during this time: hear me, protect me, prepare me, support me, and care for me. Those are absolutely critical. And considering strategic investments in your workplace experience based on this continual listening to your workforce can reinforce the culture of flexibility, the things that people are looking for. Flexibility. It's going to increase innovation and problem solving from your folks. It's going to improve employee engagement. It's going to reduce turnover and ensure that your organization can navigate these macro events, because we're sure to see these happen again down the road. This isn't a one-time scenario here the past a couple of years. And so I'll end with a great quote that I don't have a slide for, but a great quote that I love from a psychologist named Louis Cozolino. We're no longer the survival of the fittest. We are survival of the nurtured. So make sure that you nurture your folks if you really want to win the war for talent. And with that, Kenan, I'll turn it over to you. I think we've got some time for Q&A today as well as part of our conversation. If you'd like to see if we have any questions.
Yeah, if anybody have any, I mean, I haven't seen any questions come through, but at the end of the day, we'll also give you the email at the end of this webinar if you have specific questions for Bruce or Mark or myself. But just have anybody have any comments or questions? Well, again, gift of time, everybody. Thank you so much. You know, this is Mark and Bruce's information, and first initial and last name at veracity.com, or you can reach us at partner@rgphealthcare.com. Again, thank you so much for your time. Appreciate all that you're doing. And for those of you, I mean, clearly all the everyone of you there in healthcare, thanks for doing what you do
Absolutely.
every day.
Yeah.
Right?
Yep.
And
Stay safe, everybody.
yes, thank you.
Thanks a lot.
Have a good
Bye-bye.
day.
Take care.